Could I introduce Richard Bliss and Kate Farnell, our next speakers, who are going to give the Radioiodine UK patient perspective. Could I also ask you to take these interactive devices? They're just to the back of your armrests on the right-hand side.
Stand on the left or the right?
Wherever you want me. I'll stay here. Go on.
You want to start?
Yeah.
Yeah, go on.
Okay, this is the easy part now. So there shouldn't be too much engagement of grey matter. But this is basically looking at the perception of thyroid cancer from patients. So Butterfly Thyroid Cancer ran a survey, well, Kate ran a survey, of patients throughout the country, and these are some of the results of what's happened to different patients around the place. Shave the beard off. It's a cheaper divorce, certainly.
So this is who we are, really.
Yeah.
This is our double act.
Kate insists on showing the picture on the right. I don't know why. Whereas actually it's the one on the left, which is by far and away the most important. There are donations if you guess the right person. So it's 11 years since Butterfly last did a survey of patients in the UK. And Kate spends a lot of time answering the telephone. Lots and lots of questions keep cropping back up again, and still do from the 15 years that Butterfly's been in existence. But she's looked at patients from the last 5 years, so just from the last trial to now, to see where we stand.
So we kept it just to the last 5 years, obviously for relevance, because things have changed a lot in the last 5 years. So what did we hope to learn? We wanted to look at the impact of the treatment from as many people as we could across the UK. And as Richard said, I get asked the same questions and I'm told the same things from you guys every day on the helpline. So are we doing things differently across the UK? Well, you're going to see that yes, we are. Find some areas that need improvement. Hopefully we'll have the results published to make the doctors aware, and we'll present the findings at conferences like today, and I'm happy to be doing it tomorrow at Dr. Newbold's conference as well, which is all for doctors. Richard?
So 400 responses. As expected, majority female. Again, as expected, a reasonable age range from the very young to the more elderly. But again, that sort of midlife peak. But of particular interest is 65 different centres participated. So pretty much we've got the whole country covered with results from this.
When I did a patient survey in 2011, we asked some of the same questions that we've asked you recently. And as you can see, almost 2/3 of patients weren't given clear written information about their disease. Only 30% received information. So we've asked you this again, and you need to get ready to vote. It's just like X Factor.
So if you think 58% receive information now, press 1. 2 for 78%, 3 for 98% of patients receive information prior to their treatment.
Okay.
Not bad.
So
30% to 52%. It's a good improvement.
that's the answer. So 98% were given information. This is all good. This is why we want you to see the results compared to what you may perceive. Were you happy with the information you received? Well, 86% said yes, but we're going to question that as well, because that's what we always do. Of you guys that weren't happy with the information, these were some things that came up again and again and again. It was vague. The low iodine diet, which is the bane of my life on the helpline. I'm sorry, but every time somebody rings up and says, "Can I speak about the diet?" I want to say no, because it's, you know, it really causes so much anxiety. Information on, John touched on disposal of clothes, using a mobile phone. It's really important when you're in isolation for 2 or 3 days. Can you use your mobile phone? It's the only way you've got contact with the outside world. How much radioactive iodine am I getting? Do I really need it? Worried about the side effects, obviously. Emotional aspects, you know, your whole life's turned upside down when you're diagnosed with cancer, and you're worried about how far are you going to be away from the kids? How long are you going to be away? And John mentioned issues with breastfeeding, and that's going to come up as well. Richard.
So, the vast majority of people, as we know, have been asked to follow a low iodine diet prior to radioiodine, but a significant number, about 1 in 8 or so, didn't need to change their diet at all. Then this is while you were actually in hospital in the iodine treatment room. So a third stayed on the low iodine diet after being given their iodine capsule. 2/3 had a normal diet, or at least weren't told to avoid iodine while in hospital.
And this is really important because patients are so anxious about the diet, they want to make sure that they're doing their utmost to make the treatment work. And to do that, we do the diet. Certainly in my unit, and when I had my treatment, I had to stay on the diet until I left hospital, and that's how it is. But you can see across the country, patients are getting very different advice, and that really needs to be sorted out. Very big thing for patients who are having treatment is they don't want to come off the thyroid hormone to have the treatment. Happily, things are getting better. In my day, we did have to come off, and it was miserable. I've done it both ways. I've done it through withdrawal, and I've done it with Thyrogen, and there is no comparison. If you can have Thyrogen, you need to be shouting about it. So when we did the survey in 2011, we asked how many people were offered Thyrogen instead of having to come off the thyroid meds. And you can see only 37%. Getting ready to vote again now. So in 2016, what percentage of patients had Thyrogen? And bear in mind that the British Thyroid Association, the new guidelines last year, recommends that patients get access to Thyrogen. So, is it 55, 65 or 75%? Voting is open. Okay, so that's what you think.
And the answer is 2/3 get yes.
It's still not good enough. It's still not good enough. And I have calls all the time, newly diagnosed patient, and they've got 2 young children, and their team are expecting this young mother to become hypothyroid when there's a drug there, and in my centre we've used it routinely for 15 years. You know, so that needs looking at. Richard?
So this was, again, since Hilo came in, the dose of radioiodine has been less fixed, and it's been more tailored to individual need, as John was saying. So again, how many patients know which dose of radioiodine they had administered? It is particularly important for patients who then may get recurrent disease, because as we know, the increased risk of future complications is dose dependent. And most people, well over half, don't know the dose that they've been given. It's just what I'm saying. And this refers back to the previous slides about people being happy with the advice they were given. And I was very surprised at that, in that 86%, if you remember before, were happy with the advice they were given, the information they were given prior to treatment. Yet 40% of patients still say they're afraid of radioactive iodine.
So if you were happy with what you were told, why are you frightened of having radioactive iodine? And these are some of the things that you told me. And, you know, it all makes sense that it would damage healthy parts of my body as well as attacking the cancer cells. Fear of it affecting my hair, fertility, and would the procedure actually work or not? It's radioactive material that you're swallowing. It's very scary. You worry about your side effects and exposure to others. Being in isolation, patients hate it, the thought of it, having to stay away from their family. And one lady went in to have a radioactive iodine. She hadn't been told to stop breastfeeding, so the treatment had to be delayed. And, you know, the psychological impact on that is awful.
So even though the number of people receiving information is vastly improved in the last 5 years, as a group of professionals, we certainly need to look at the information we are giving patients, because a significant number of patients are still frightened of the treatment they're about to undertake.
Yeah.
So,
Want to do this one?
Next question then. Go on your keypads. Claudia Winkleman's term and conditions. What percentage of patients tucked away in their iodine room in the corner of the ward, actually feeling reasonably well, hopefully if they had thyrogen? So how many patients were completely ignored by nursing staff while in the radioiodine room?
That's not what we're asking.
Sorry, it was a leading question. Sorry.
So these patients have cancer, they're frightened, they're scared, they might be feeling okay physically, but they're still being treated in a cancer unit, they're still newly diagnosed with cancer. So we go in to have the treatment, and what we asked you was, what percentage of patients had contact whilst in hospital with nursing staff? You can vote now. Bang on. Only 50% of patients had contact with nursing staff. And that certainly was my experience, and I know it's still happening now. And nurses can't come and sit with you because you're giving off radiation, so it's not safe. And you should be told that before you go in, so you can expect that to happen. But that doesn't mean that they can't come along, put their head round the door and say, how are you doing? Are you okay? That's all we need. But in some centres, I know that has to be improved. So there we go. I'll do this, but then you can do the good. You can do the good bit.
Right.
Okay.
Okay.
So we asked, what if anything could have improved your stay when you were in? And we're going to see, you know, again, there's differences between the way things are handled in different units. So after receiving my RAI at 4 p.m, didn't see anybody till 2 a.m. the next morning. We need a more inviting room and more staff coming along to check. Availability to speak to someone who knew about the process, not just bits of it, i.e. one nurse knew about giving Thyrogen but didn't know about my thyroxine and vice versa. Patients know it's difficult in a lead-lined room because internet access is quite difficult, but if you can get it and you're able to have Skype, some contact with friends, it makes the isolation more bearable. We've done that in Newcastle and it has made the patient experience much better. For the most part, I felt abandoned, and any requests I had, especially for help with nausea, via the phone to a nurse, made me feel as though I was just annoying someone. But it's not all bad.
So excellent information from the medical physics department. Very happy with that. Very good work. Very happy with how things go. And treated very well overall. So it's very, very mixed picture that's coming out.
Yeah.
Both of nursing staff, medical physics departments. So John alluded to clothes, which we'll get onto, One of the others is mobile phones, which people get mixed messages about as something that comes into the iodine room, which is in close contact with your skin. So, without being a yes or no question, it was just generally what advice was given regarding the use of mobile phones. And there's a few things that surprised me, I must confess. So, rubber gloves, cling film, chuck it out, just get a cheap £5 phone, chuck it out afterwards, to no restrictions whatsoever, absolutely fine, checked by nuclear medicine on leaving and was found not to be radioactive. Visiting arrangements, again, we've mentioned about access of family and friends to people in radioactive rooms. Again, advice given, plastic capes and shoes. Not sure quite what you're aiming to do by that, but never mind. Standing against the wall away from the bed. Backs to the wall for all sorts of reasons, but that might not be one of them. No visitors if possible. Preferably you can semaphore from outside the door or something, who knows. Limit visitors. Reason explained in advance. That's good. And anyone could visit, but communicate through a window. So, again, this huge variation across the country.
I'll do this one.
Disposing of clothes.
Yeah, so I know from all the messages I get that this is still happening in some centres. They're still saying to patients, you've got to get rid of the clothes that you're in hospital. You have to leave them in hospital. I had a lady last week who lived on a farm, and her nurse had said, bring in your oldest dressing gown. And she said, I've only got one dressing gown. And I said, well, take it in and it's fine. You can take it home with you. It's fine. You just wash it and it's fine. And Cancer Research UK always have nice stories up about rare cancers. And this week they had one up about a young girl who had just had her treatment. And she was told, and she did it, to keep her clothes in the garden shed for 6 weeks. Really absolute madness. And, you know, it's like, oh, no, not my lucky pants. I don't have to throw them away. Really. Are you wearing your lucky pants, Richard?
I don't know. It was dark when I got dressed this morning.
And you missed the train.
And I missed the train. Yeah.
So, what percentage of patients were told to dispose of their clothes?
Voting is now open.
Yeah. Still nearly half of centres are telling patients to dispose of their clothes. And as John said, it's not necessary. Most centres will provide, the centres that aren't seeing that, will provide a bag, you put your clothes in it, you wash them once on their own at home, and they're good to go.
So again, coming back to the question of quality of information. So length of time in hospital coincided with the time given. Generally not too bad. So 4/5 were right for that. But the range was phenomenal. 6 to 8 weeks, 22 days. Overall average is 14 days. Now, I don't work in the cancer centre, but I can imagine what on earth our directorate managers would be saying if we told all our patients they were going to be in for 2 weeks. So it's a vast range of contact with others. So how many people actually followed the advice they were given? Or did you get just so sick of it, you really couldn't be bothered? But most people are very good, and most people believe what they're told.
And that's why we have to get it right. Because, you know, if you've got young children and you're being told to stay away from them for 3 weeks, which is unnecessary, the anxiety and upset it causes is massive. But patients do follow what they're told. We do it. And the range of staying away, I get calls on this all the time, and hospitals will let you out when you're safe, but you should have an individualised card like Tom was talking about that tells you how long you stay away. But, well, I think some centres are are doing that.
I think quite a lot of centres are actually.
I think they are. So, side effects after RAI, we asked you about that. You can do this one, Richard.
So, as expected, most common taste disturbance, dry mouth, significant number of sore neck, nausea, but a third have absolutely no symptoms at all, which is nice to see. And that's in table form for the numerically dyslexic like me. So following radioiodine, those are the figures there. So in conclusion.
So most patients are getting information that they're happy with, but more time is required for RAI counselling to dispel the fears that patients have. The low iodine diet, it's obvious, it still causes unnecessary added stress. Even Tom, who's a doctor, he lost weight because you're trying to do your best. And some centres don't use it at all in the country. Some say 3 weeks, some say 2 weeks, some say 1 week. So that needs sorting out. We definitely need to educate the nurses on the wards more. Patients are still cancer patients and they need your support and reassurance when they're in there. Are side effects more common than perhaps the doctors realise? And there is huge disparity in the information given out to you guys between the centres on the use of your mobile phone, disposing of your lucky pants, and the discharge information re-contact with your families. So I want to say thank you for everybody who completed the survey, to everyone who advertised our survey to boost recruitment, to Dr. Jamie Harding who collated all of the information, and to my pal Mr. Bliss. Thanks very much.